Well, we've all seen it in the movies, right? People staring at that swinging pocket watch 1 minute, hypnotized the next, and then suddenly they're clucking like a duck on a stage in front of everybody on YouTube, right? Hypnosis is supposed to put folks in a deep trance and is able to change their behavior in one way or the other. And now we're hearing about medical hypnosis, where patients actually overcome a number of physical problems. Dr. Richard Furshine is the medical director of the Furshine Center for Comprehensive Medicine right here in New York. And Doc, you say some of your patients have used hypnosis. In what capacity?
Well, I recommend hypnosis, and I've actually used hypnosis for my patients. There was a study that just came out last week, and it was published in the Scandinavian Journal of Gastroenterology. And what they found was that patients that were put under hypnosis had a 40% reduction in the number of cases of individuals who suffered with irritable bowel syndrome. Now, that was important not only for that study, but another study which showed 7 years later, 85% of those patients also had a reduction in symptoms. I use it for people who have asthma, who are dealing with drug addiction, smoking problems, and pain problems.
Now, you're not hypnotizing us right now, right? There's no sort of secret thing that's happening. Now, you don't do hypnosis yourself. Do you send your patients to a specialist? Is that how a patient of yours would get hypnotized? Well,
I do both. I've actually been trained in hypnosis, and I've also recommended my patients go to certified hypnotherapists. There is a problem with hypnosis at this point. It's not a certified specialty, so people need to be careful about where they go for these particular treatments. It's why I recommend that most patients go to physicians who've been trained.
So what is the difference between, say, positive visualization or meditation and hypnosis?
Well, the first stage of hypnosis is really the induction phase, and that's the place where we give people information that helps them to relax. We'll generally put them in a calm state of mind. They may visualize something, a calm river or a stream.
I'm sort of relaxing right now just thinking about it. Go ahead,
Doc.
Yeah,
and you put that in your mind, and that allows you to be primed to be induced and into a state of a trance. Now, about 85% of the population go into a trance, 15% can go into a deep trance, 15% are resistant. So even though some people are resistant, they still get the benefits of hypnosis.
Okay, so let's say it works for one of your patients. How long will it work? How long will it affect their behavior?
Well, in this particular study I mentioned, it had a significant effect 7 years after the treatment was stopped. So people go into a specific protocol. They might do 6 to 8 treatments. And then what we'll do is we'll monitor them, and if they need additional tune-ups, we'll put them in for a tune-up. I think one of the things that's so interesting about hypnosis is now we actually have the research that's showing that it works in PET scans and MRIs that actually look at hypnosis. We've been able to look at the right and left side of the brain, and what we find is that people under hypnosis are fully aware not only of what they're doing. It's not that they are not aware, they're fully aware, but they're able to activate parts of their brain that would not be activated if they were just to visualize.
You know, it's interesting to see the list. The Wall Street Journal had a list of things that hypnosis can affect, from phobias to smoking to weight loss to dental work. Does insurance cover it?
Not at this point. You know, again, if you go as part of a traditional office visit, when your doctor's examining you and evaluating you, many times that could be part of what the treatment program is. So this is something that's very effective. It's going to be very cost effective. And I have a feeling that this is going to become a very important part of our standard medical care, particularly when we know we don't have to use medications and we don't have to use treatments that, like, you know, painkillers, which can be very toxic.
Very attractive for that reason, but be careful, as you mentioned, about the credentials. There's nothing standardized for states, so you really have to do your research before you just launch in to getting hypnotized. All right, Doc, nice to see you again. Dr. Furshine.
Thank you very much for having me.
Great to have you.
Human mind is a very powerful thing, isn't it?